As healthcare providers can tell you, the beginning of the school year can bring some interesting office visits from children. From sore throats to foreign bodies, the specialist at Lake, Ear, Nose, Throat, and Facial Plastic Surgery shared with us some of the more common and sometimes surprising things they see in their pediatric patients.
We see children all the time with different problems from being at school because they are so full of germs and different viruses, and of course kids share everything. They give each other kisses and hugs and all that good stuff. But the biggest advice to parents, I would say, is make sure that you teach your kids how to wash their hands. That's the most important thing, and having them not touch their face. And the more that kids can do that, the better off that they're going to be.
Typically, if a child is having problems with fever or irritability, or it's a sudden onset, then it may be more infectious in nature. If it's a long-standing problem and the child doesn't have much fever or it doesn't seem to bother them that much, a lot of times it can be more of an allergy-related problem. We also see kids that have a lot of tonsil problems, and they can manifest in several different ways, including sore throats and strep throats, which occur very frequently. But also children can have enlarged tonsils, and that can cause a variety of other problems, including snoring and sleep disordered breathing, which includes sleep apnea. And that's actually where a child actually stops breathing for 10 or 15 seconds at a time and almost has to wake themselves up to continue breathing.
I've seen a lot of children that come in for behavioral issues. They're on ADHD medication that end up having snoring and symptoms of sleep apnea. We get a sleep study, they get their adenoids and tonsils out, and parents come in saying they have a new child.
Frequently we will have kids that have put things in their ears or their nose, anything from raisins to erasers to watch batteries, and it's definitely something that occurs, typically in younger kids, but sometimes older kids as well.
I can recall a piece of flip-flop in one child's nose that I had to remove, and usually it's beads off of hair beads or popcorn kernels.
I've had a Trident wrapper up the nose. I've had a pea up the nose. We've had 2 erasers recently up the nose. We actually got a call from a primary care or pediatrician stating that the child had something up their nose, pulled out an eraser and found out there's one more behind it. Because it's a hole, why not? That's why kids always put things in places. They see what will happen, and they're very curious. They want to find out what's going to happen if they do something, and usually more often than not, it can't come out by itself, so we have to help them.
For more information on the specialist or the services available at Lake, Ear, Nose, Throat, and Facial Plastic Surgery, please click on the Kids Will Be Kids story link on our homepage at yourhometownhealth.com.